Did you know that doctors can spot serious health issues in under 60 seconds just by noticing your personal hygiene habits? I'm Dr. Emily Reynolds, and after 30 years in geriatric medicine, I've seen how small hygiene oversights can reveal major health concerns. Take Harold, my 75-year-old patient from Phoenix. Active, independent, and never missed his grandkids' baseball games. Yet during a routine checkup, I immediately noticed 3 critical hygiene issues signaling a dangerous underlying condition. I had no idea, Harold later confessed. I thought I was taking good care of myself. Unlike most health videos full of general advice, today I'm sharing the exact hygiene mistakes doctors immediately notice and the simple fixes that could add years of independence to your life, not just to prevent illness, but to help you thrive with dignity and joy. Before we dive in, I'd love to know which city you're watching from. Drop it in the comments below and hit that subscribe button for more practical health insights. Now, let's start with the most overlooked hygiene mistake that could be silently affecting your heart right now. Mistake 1: neglecting oral hygiene. Brushing our teeth has been part of our daily routine since childhood. But here's a question that might surprise you. Are you actually doing it correctly? Most of us don't give our oral hygiene much thought anymore. It's just something we do on autopilot morning and night. But that seemingly simple routine might be hiding a dangerous connection to your overall health. What many of my patients are shocked to learn is that the health of your mouth is directly linked to the health of your heart, brain, and entire body. Recent Harvard Medical School research confirms something remarkable. The bacteria from untreated gum disease can silently enter your bloodstream, triggering inflammation that damages your heart valves and blood vessels. In fact, people with poor oral hygiene are 3 times more likely to experience serious cardiovascular problems. Margaret's story still stays with me. A vibrant 72-year-old retired teacher from Oregon, she came to me complaining of fatigue. During her exam, I noticed her gums bleeding just from gentle pressure. "Oh, that's been happening for months," she casually mentioned. "I figured it was just normal at my age." 6 weeks later, her cardiologist discovered inflammation in her heart valves, directly linked to those bleeding gums we'd spotted. "If only I'd known that my toothbrush could have helped protect my heart," Margaret told me later, with a shake of her head. "The solution is simpler than you might think. First, take a good look at your toothbrush today. If it's frayed or older than 3 months, replace it. Brush for a full 2 minutes. I tell my patients to play their favorite song while brushing. And don't skip the flossing. And please keep those dental appointments even if you wear dentures. Just 4 minutes each day, 2 minutes, twice daily, could help protect your heart for years to come. I think that's a worthwhile investment in your health, don't you? Tell me in the comments, when was the last time you replaced your toothbrush? Your honest answer might inspire someone else to make this simple change today. Mistake 2: infrequent bathing and skin care. Let's talk about something many of us experience as we age but rarely discuss openly: changes in our bathing habits. Maybe your skin feels drier now, or getting in and out of the shower isn't as easy as it once was. Perhaps you were raised to believe that daily bathing wastes water. Whatever your reason, if you've reduced your bathing frequency, you're not alone. But you should know what your doctor sees in this change. Your skin is actually your largest organ, and it functions as a window to what's happening inside your body. Doctors at Mayo Clinic have documented how skin changes often reveal early signs of serious internal conditions before other symptoms appear. Their studies show that nearly 40% of undiagnosed medical conditions in patients over 65 could have been caught earlier just through proper skin observation. William, a 77-year-old retired postal worker from Michigan, learned this the hard way. I thought bathing once a week in winter was plenty, he told me with a sheepish smile. Why dry out my skin unnecessarily? During a routine checkup, I noticed subtle discoloration on his lower back, something William couldn't see himself. Testing revealed early-stage kidney disease that might have gone undetected for months without that simple observation. I had no idea my skin was trying to tell me something so important, William said later. Here's my practical advice. Establish a regular bathing schedule, at least 3 times weekly, even if you're not particularly active. Use mild, fragrance-free soap that won't strip your skin's natural moisture. After bathing, apply moisturizer while your skin is still slightly damp to lock in hydration. Most importantly, make a habit of examining your skin regularly in good lighting, looking for changes in color, texture, or sensation. Remember, healthy skin isn't just about looking good. It's about having a healthy inside that shows on the outside. Your skin has a story to tell about your internal health. Are you listening to what it's saying? I'm curious. Do you have a regular routine for checking your skin? Share your approach in the comments. Your system might help someone else develop this important habit. Mistake 3. Ignoring nail care. When was the last time you really looked at your fingernails and toenails? I don't mean a passing glance while washing hands or putting on shoes. I mean really examined them? Most of us don't give our nails much thought, but doctors like me consider them invaluable windows into your overall health. What fascinates me about nails is how much they can reveal. According to the American Academy of Dermatology, changes in your nails can signal over 20 different systemic diseases, everything from anemia to thyroid disorders to heart disease. In my practice, I've seen nail abnormalities lead to the diagnosis of previously undetected internal conditions in nearly a third of my senior patients. Charlotte, a lively 78-year-old grandmother from Florida, came to see me for persistent fatigue. During our conversation, I noticed her toenails had become unusually thick and yellow. "Oh, that's just an old person thing," she laughed when I asked about them. "I just wear closed shoes now so nobody has to see my ugly toes." What Charlotte didn't realize was that her nail changes weren't cosmetic. They were signaling a severe fungal infection that had flourished because her immune system was significantly compromised. Further testing revealed an underlying condition that required immediate treatment. "I had no idea my toenails were trying to warn me," Charlotte told me later. "I thought they were just unsightly, not messengers about my health." The solution doesn't require expensive products or complicated routines. Trim your nails regularly, straight across with slightly rounded edges. Keep them clean and dry, and wear breathable footwear. Most importantly, never ignore changes in nail color, texture, or thickness. These aren't simply cosmetic issues or inevitable parts of aging. Think of your nails as your body's own health dashboard. Sometimes the warning lights appear here first, long before other symptoms develop. Are you checking your dashboard regularly? Have you noticed any changes in your nails recently? Share in the comments. You might help someone else recognize an important health signal they've been overlooking. Mistake 4. Improper incontinence management. Now, let's discuss something that might make you uncomfortable. But what if I told you that avoiding this conversation could be putting your health at serious risk? I'm talking about urinary incontinence, an issue that affects over 50% of seniors, yet remains one of the most hidden health concerns I see in my practice. The shocking truth is that many people consider occasional leakage just a normal part of aging, something to be managed quietly with makeshift solutions. But urologists at Johns Hopkins Medicine have discovered that untreated incontinence doesn't just affect your quality of life. It can mask serious conditions like bladder or prostate cancer, lead to dangerous skin infections, and significantly increase your risk of falls. Richard's story still haunts me. A distinguished 73-year-old retired school principal from Arizona. He began experiencing occasional leakage, but was too embarrassed to mention it during checkups. "I used paper towels and changed clothes frequently," he confided later. "I thought I was handling it." By the time discomfort finally drove him to seek help, doctors discovered an advanced prostate condition that could have been treated months earlier with much better outcomes. "My pride nearly cost me everything," Richard told me, his voice breaking. "All because I couldn't bring myself to have a 5-minute conversation with my doctor." The solution isn't complicated, but it requires overcoming that initial embarrassment. First, please know that healthcare providers discuss this issue every day. There's truly nothing to be ashamed of. Use proper absorbent products designed specifically for incontinence, rather than makeshift solutions. Maintain careful hygiene to prevent skin problems. Most importantly, recognize that incontinence is not simply part of getting older. It's often a symptom that something needs medical attention. Remember, your health is always more important than momentary embarrassment. Dignity isn't found in hiding health concerns. It's in addressing them openly so you can continue living life on your terms. Do you know someone struggling with this issue silently? How might you compassionately encourage them to seek proper care? Mistake 5. Ear hygiene errors. I need to ask you a personal question. Are you still using cotton swabs to clean inside your ear canals? If you're nodding yes, you're not alone. This is perhaps the most common hygiene mistake I see among my patients over 65, and potentially one of the most dangerous. Many of us grew up being told to keep our ears spotlessly clean, often with cotton swabs pushed deep into the ear canal. But ear specialists now warn that this common practice can cause serious harm. Research from the American Academy of Otolaryngology shows that improper ear cleaning is responsible for nearly 40% of ear canal injuries in patients over 65, with many cases leading to infections that could have been completely avoided. Susan, a 71-year-old retired librarian from Seattle, learned this lesson the hard way. "I've cleaned my ears with cotton swabs my entire life," she told me during an emergency appointment for severe ear pain. Susan had accidentally punctured her eardrum, leading to an infection that spread to nearby tissue. What began as a routine hygiene habit ended with weeks of treatment and permanent hearing damage that could have been completely avoided. "No one ever told me it was dangerous," she said, shaking her head. "I thought I was doing the right thing." Here's what ear specialists want you to remember. Your ear canals are largely self-cleaning. Wax serves an important protective function, and most of it naturally works its way out during regular jaw movements, like talking and chewing. The safest approach? Clean only the outer ear with a warm, damp washcloth. If you feel you have excess wax, use ear drops specifically designed to soften wax, following package directions. And please remember this simple rule. Never insert anything smaller than your elbow into your ear canal. Your hearing is precious and increasingly vulnerable as you age. Doesn't it deserve the same careful protection you give your eyes and heart? How do you clean your ears? Has this information changed your thinking about this routine habit? Mistake 6. Poor foot hygiene. When was the last time you really looked at your feet? Not just a passing glance while putting on socks, but a thorough inspection between the toes, the heels, checking for changes in color, feeling for temperature differences. If you're like most of my patients, the answer might be, "I can't remember," or even, "I can't see them well anymore." Yet podiatrists specializing in geriatric care emphasize that your feet contain vital clues about your circulatory and nervous system. They're often the first place to show signs of serious conditions like diabetes, peripheral artery disease, or nerve damage. the American Podiatric Medical Association reports a startling statistic. Proper foot care and regular inspection could prevent up to 85% of diabetes-related amputations. That's not a typo. 85%. Robert, a 76-year-old retired factory worker from Illinois, came to me for just a checkup last year. When I asked about his feet, he casually mentioned some persistent dryness and small cuts that weren't healing well. "They've been looking rough for years," he shrugged. "Just part of getting older, right?" A closer examination and subsequent testing revealed early-stage diabetes, caught at a point where lifestyle changes could still make a significant difference. "If you hadn't checked my feet," Robert told me months later, "I might have gone years without knowing I had diabetes. By then, the damage would have been severe." The solution is surprisingly simple. Wash and thoroughly dry your feet daily, especially between the toes where fungus thrives. Inspect them regularly for cuts, sores, or changes in color or temperature. Wear clean, dry socks made of natural fibers and apply moisturizer to dry areas, but not between the toes. Most importantly, never ignore pain, numbness, or wounds that don't heal promptly. Your feet have carried you through a lifetime of experiences. Taking a few minutes each week to care for them properly isn't just about comfort. It could save your life. Have you noticed any changes in your feet lately? This simple question could start an important conversation about health. Mistake 7. Medication-related hygiene issues. Here's something that might surprise you. Those medications keeping you healthy could be causing unexpected hygiene issues that signal potentially dangerous side effects. This is perhaps the most overlooked connection I see in my practice, yet addressing it could literally save your life. Many commonly prescribed medications can cause dry mouth, excessive sweating, or changes in body odor that aren't just social concerns. They're potential warning signs of medication toxicity. Pharmacologists at the American Geriatric Society have documented that nearly 40% of adverse drug reactions in seniors present first as changes in personal hygiene needs, well before more serious symptoms appear. Barbara, a 67-year-old retired nurse from Florida, experienced this firsthand. During a routine visit, I noticed an unusual odor despite her obvious good hygiene. Rather than embarrassing her, I asked about recent medication changes. This simple question led to the discovery that her body was showing early signs of liver stress from her current medication combination. "I was showering daily and using deodorant," Barbara explained later. "I had no idea the smell was coming from inside my body, not from lack of cleanliness. I just thought, at my age, body odors change. If you're taking multiple medications, pay attention to new hygiene challenges. Keep a simple journal noting any differences in body odor, sweating patterns, or mouth dryness after starting new medications. Stay properly hydrated unless your doctor has restricted fluids. Most importantly, report unusual sweating or odor changes to your doctor immediately. These could indicate dangerous drug interactions. Remember, your body often whispers before it shouts. These subtle hygiene changes might be its way of alerting you to a problem long before more serious symptoms develop. Isn't that whisper worth listening to? Do you track potential side effects of your medications? What system works for you to monitor these changes? Your experience might help someone else create their own tracking system. As we've explored these 7 critical hygiene mistakes, remember that proper self-care isn't just about appearances. It's about protecting your health, independence, and dignity as you age. The beautiful truth is that small, consistent changes in your daily routine can have profound effects on your well-being and longevity. Your body communicates with you every day through signals that doctors like me are trained to notice. By becoming your own health advocate and addressing these simple hygiene practices, you're not just preventing illness, You're choosing to thrive. What small change will you make today? Your future self will thank you for that simple act of self-care and respect.